Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Well, thank you very much for having me on your program.
Well, let's begin at what's in the news right now. Could you give us an update on St. Cuttsburgh mission?
Well, St. Cuthbert's mission, we continue to monitor the situation. As I said, we have a permanent presence, medical presence that is, at St. Cuthbert's. We have 2 doctors, we have a number of nurses that have gone there and have stayed there and would be there for the duration of the lockdown. The nurses and the doctors have been doing a house-to-house kind of assessment. And so far, as you know, we have 239 confirmed cases. We have done some swabbing yesterday. We are going to get back those results sometime today. And we anticipate that we will have some increases. Aside from that, a little bit of good news with St. Cuthbert's is that while we have been monitoring our patients, we were able to discharge at least about 41 persons who have since had the disease, met the criteria. They were asymptomatic for the past 10 days, and now we have discharged them. So the numbers would go down slightly, but we'll still have a number of cases as we continue to test. But as I said, we are going to monitor. We have our team there, and we'll make sure that if anybody develop any symptoms, and they needed hospitalization, then we'll move them.
All right. I was going to ask you about the initial lockdown, but as you said, the numbers are, it's decreasing, so we...
Well, no. We have 239. I think if we continue testing, we'll see a few more. But while we are testing and maybe finding a few more people, we are also discharging because, again, most of the cases there have been asymptomatic.
All right. In terms of resources for the team on the ground, bearing in mind, as you said, that you may get some increases because tests are ongoing. Yeah. Is there any particular need that the team has? Have they indicated to you?
So far, no. What we have been able to do is to give them all the meds that they need. We have given them the kits that they need. So they have all the things that are necessary in terms of responding to COVID. And so far it has been okay. We have been talking to the residents, and one of the things that they have been telling us is that they probably would need some hampers, and we have been working through the Prime Minister's office and CDC to get some hampers to them. So we'll see how that goes during this week.
Right. And just to remind, I believe that yesterday you a team was sent in to conduct spraying and more so to educate persons on sanitization.
That happened over the weekend and it continues, so that aspect of the work is ongoing.
Okay. All right. I wanted to ask you about the training that started. I believe it started in Region 2, then Linden, and that was really important because that training was for health workers. Could you give us an update as to how many regions they perhaps been to already and where they're going to next?
Well, we are looking at probably touching 6 regions, and we have completed 2 so far, so the team has been moving around. This is a team from the United States who has been working along with our local doctors to provide hands-on training in terms of management of COVID, especially looking at how to use ventilators and so forth. So the feedback so far has been good. Doctors have been very receptive. They have, they know some of these things, so in some cases like a refresher course. In others, based on the experience of the team that is doing the training, they are bringing their experience with handling larger volumes of COVID-19 patients and explaining some of the practical things and the nuances of the management. So I think it's a good exercise for our local doctors and nurses.
Yeah. As we're speaking about the regions, of course, can you give us a little bit of an update on Region 1?
Region 1, well, we're happy that we have reduced the cases in Quibana. But as I had flagged, we are looking now at Warapoka, where we have 18 cases. And so we'll continue to monitor them and to ensure that all the necessary measures are taken. In Bartica, we've had a spike in cases. So currently we have 42 cases. And again, we're taking all the necessary precautions. In Bartica, we are doing contact tracing. We are monitoring these patients who have tested positive. And that's being done by the Regional Health Task Force.
Any cases in terms of isolation or so?
Yes, most of these are either going to be isolated at home or they're going to be in our isolation facilities. So these are the two options that we offer to patients who have tested positive.
Okay, sir. I wanted to talk to you about the side effects, or rather negative effects of COVID-19. But before we go to that, let me just talk to you about the fact that some sporting events are now starting back. Recently, over the weekend, we saw that the Prime Minister, well, he, what did they say, roll the ball in cricket? Anyway, he
Bowl the ball.
Bowl the ball. Thank you. You see, all right. So cricket is one, and it's a major sporting event starting back. So, what is in place to deal with that specifically? And a follow-up to that is most of these sporting clubs, they have like a bar, but we know that bars are not open. So what is being done to ensure that guidelines are followed?
Well, that's a very good question. One, we have made provisions in the order that is currently in force for limited provision of sporting events. In the specific instance of cricket, we have granted permission for cricket matches, but without spectators. And along with the permission, among the conditions that they have to uphold is that bars at these events must be closed. There must be no bars, and there must be no drinking of alcohol or other beverages, because as you know, if you encourage that, that's going to create problems. So one, it shouldn't be a spectator event, and two, no bars are allowed. So it's very clear. So there are conditions to these events, and as people apply for them, these conditions are made known to them, and the Secretariat would be sending out teams to do random checks, and if they're not in compliance with the stipulations, then we can close the event down. So we are very serious because, these events can, if not managed properly, can become super spreaders, where a lot of people congregate and then they get infected and they can spread the disease. And the reason why we don't want bars at these events, again, when you have to drink, you have to remove your mask, and if somebody is near to you that is positive, you would be exposed to them and you will get the disease. So we are trying to break that chain of transmission, and the only way we can do that is to prevent obvious sites where people can get exposed.
Well, from bowling the ball for cricket, have any other sporting fraternity or organization indicated that they perhaps would want to, open back?
I think we have gotten a request from golf, and again, the nature of golf can allow for its reopening, but again, you have to abide by the rules that we have set. So we are trying to work with the various sporting organizations, and as we work with them, we are ensuring that rules are in place to minimize exposure to the virus.
Okay, thank you, sir. The question before COVID-19, obviously there would be side effects. We've spoken about this before. Aside from the physical, what about the mental side effects of it, and what the ministry has in place to deal with that? I know we've already started training with the, in terms of mental health for the health workers. Do we have enough facility? Do we have enough to deal with that? And not talking only about the health workers, but citizens generally.
So, our traditional view of COVID-19 is that it affects the upper respiratory tract, meaning like your nose, and as the disease progresses, it goes down to your lungs, which is the lower respiratory organs. And that has been our traditional view. But with learning more about the disease, we know that COVID-19 affects more than the respiratory system. And in fact, we have now seen information where it can affect your digestive tract, where it can affect your kidney, your liver, your brain, heart, and so forth. So this is a disease that we are learning more about every day. And in terms of the brain and the nervous system, you can have a number of conditions that arise from infections associated with COVID. Some of it can be immediate, and some of it, even after the person is no longer infectious, they can have other signs and symptoms that persist. And that is now referred to in the literature as long COVID, meaning that it would last for several weeks. So this is something that we are trying to learn more of, and hopefully as we work with clinical patients and so forth, we'll be able to get more information and understand how to manage those patients. But coming back to the specific question that you asked, in terms of mental health, you have the direct effects of the virus on people who would have been infected. So that's one set of persons who would have been affected. But then you have persons who are worrying about getting the virus. They're very anxious. Some persons who have isolated themselves at home, they have their own sets of issues. Some people can get depressed and so forth. So there are mental illnesses that can arise by people worrying about the disease, ranging from depression to anxiety and everything in between. And what is important is for our health system to be able to detect these conditions in a timely way and be able to counsel these patients and offer advice so that they don't have to suffer these type of mental anguishes. And therefore, the training that was conducted recently was aimed at getting more of those primary healthcare workers to understand these different ailments and how to recognize them and how to treat them. So hopefully, as the course comes to an end, the persons who participated would start practicing what they were taught, and we'll be able to respond much more better to these types of challenges with mental health.
I know initially when we spoke, you had indicated that we did not have many qualified personnel in this particular area. How positive are you that our own mental health unit will be able to cope, for want of a better word, cope
Well,
with
what
this?
we're doing is going beyond the mental health unit, actually. So medical doctors have the foundational training. So it's easier for them to expand on that. And while they might have done courses in, say, psychiatry, they hadn't really focused a lot of attention on some of these illnesses. So by doing the course that we have just taught, It is really about building upon the existing knowledge that they will have of diseases and so forth and expanding that and giving them the tools so that they can recognize mental health illnesses more readily. And so it's what we're doing is going beyond the mental health unit to persons who are actually in the community working at the primary care level. And so they're seeing patients on a daily basis, they're interacting with people, and it's just adding these set of illnesses for them to pay more attention to.
Do you foresee the need for a maybe countrywide education program? Because as much as it is not really a taboo anymore, it is a touchy subject, mental health, generally in Ghana.
Well, it shouldn't be, but as you said, there's still some stigma that is attached to it, and we have to remove that. The World Health Organization has said that issues like mental health is going to be among the top 10 issues globally that is causing illnesses. And therefore, we have to start training people, start training our staff to better make the diagnosis and do the treatment. But at the same time, we have to get more public education to make the public more aware of these illnesses and what they can do to prevent them, what they can do to recognize them, how they can treat persons if they identify persons with mental illnesses, how to work with those persons to help them get the care that they need and be supportive. Because in all of this, we have to create that supportive environment to help people to heal. And that's the kind of society that we should work towards.
Okay, thank you, sir. Can I ask you for an update on the mobile hospital? Mobile clinic, actually.
Well, as you know, President Irfan Ali has spoken to the Emir of Qatar, and we are working on getting a field hospital to Guyana. And so those discussions are ongoing, and in fact, they're in a very advanced stage. So we're expecting very shortly that we'll have those arrangements in place and we'll start getting those material in to set up that field hospital. We have identified some potential sites, but we're waiting on the finalization of those discussions. We have proposed certain sites, and we are waiting on those discussions to finalize before we announce where we are putting it.
All right, as we're on the topic of mobile hospital, our mobile COVID-19 unit, I know that last time we spoke, a schedule was supposed to be out. How is that going?
Yeah, and they have actually been moving to areas that we consider to have spikes in cases. So last week they were in the Diamond area where we have seen a number of cases, and so we wanted to test to see if there are more people that we have not been able to identify. So that mobile unit is going to be moving to different communities, and we are going to be doing the types of testing. The reason why we want to move around, because we recognize that in some regions, people are not coming out to be tested. And if we don't have the information in those regions, we wouldn't know what's happening with the epidemic. So we want to encourage people, if they feel that they've been exposed to someone who had COVID, that they can come to one of these testing sites and we'll be able to test them. So it's an ongoing exercise. As maybe by next week also, we will also add to the tests that we would be doing. We are going to add the rapid antigen test, and this would be done in collaboration with PCR. So we can do that right on the site, because we can get back the results in 20 minutes. And if it's an indeterminate result, then we'll do the PCR. So we would be able to identify more people more quickly and be able to better respond.
All right, Minister, as you mentioned the antigen test, the newsroom is asking for an update on that.
Well, as I said, the ministry itself, we have been working with PAHO WHO. They have recommended certain types of antigen tests where they feel that it has the right level of sensitivity and specificity. So these are two things that you look for in a test. So they have recommended certain types of rapid antigen tests, meaning that this test would detect fragments of the virus. This differ from antibody testing because antibody testing is a reaction that comes when your immune system reacts against the virus and produces antibodies. And so that test detects the antibodies. That's not what we are talking about here. We are talking about an antigen test that is fast. It can actually detect fragments of the virus in your body. And so we'll know that you have the virus and possibly you are infectious. Right? So that's what, this is totally different from antibody tests. I just want to emphasize that so that people are not confused. Okay, so that by next week, we are hoping to roll out these types of tests in the public sector, and we are going to send some out to the regions, and we will have some where we can use them in our mobile clinics and so forth.
All right. As we wrap up, I just wanted to ask you, in terms of challenges faced by the government in dealing with COVID-19, what would you say has been the most challenging thus far?
I think from a system point of view, we have been able to fix a number of the bottlenecks that we previously had. So whether it had to do with testing or expanding testing capacity, looking at beds and bed capacity, developing ICUs and so forth, we have been able to expand that quite rapidly. So we now have in the health system, I would say, enough capacity to deal with a certain level of patients. But the biggest challenge I think that we currently face is really compliance by people. And I think too many people have really paid scant attention to the virus. And because they have been behaving in, I would say, in an irresponsible way in some cases, not wearing their masks properly, not keeping social distancing and so forth, not sanitizing their hands, that can lead to non-compliance with a lot of these measures and ultimately lead to that person getting sick. And if that person happens to have other underlying illnesses, and if they're older, that can easily lead to them being hospitalized and ending up in the ICU. So we still have to work a lot on public education to get the message over to people. Maybe persons have become very fatigued over the years, in these last several weeks, because we have been talking about COVID-19 repeatedly. And now maybe it's just like a cliche. They hear it and they just don't respond to it anymore. And we have to change that, because if they believe it, it can't happen to them, then we have serious problems, because everybody is vulnerable here. And for the younger people who think that they're invincible, we have seen cases of mild COVID, and we have had a few cases here where after being infected, in some cases with some mild symptoms, a month after, a month and a half after, we're seeing some of these persons coming back to the hospital with cardiac complications, with renal complications, and when you go through the history, you would have seen they had a mild form of COVID. So the lesson here is that people have to take precautions, right? Whether you're young or old, you have to take precautions because this is important. And once you take those precautions and you protect yourself, then all of us would be safer.
Minister Anthony, again, thank you so much for speaking with us.
Thank you.
Well, that's it for today's COVID-19 update. We, of course, were speaking with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and, of course, our social media platforms.